Ophthalmic preparations. They are the specialized dosage forms designed to be instilled into the external surface of the eye, administered inside or adjacent the eye. The newest dosage forms of ophthalmic drug delivery are ocular inserts, gel-forming solutions, and the commonly used ophthalmic dosage forms suspensions, emulsions, ointments, and solutions. The definition of ophthalmic dosage form is they are the pharmaceutical preparations applied topically to the surface of the eye to treat intraocular conditions such as eye infections which is caused by bacteria, fungus and virus. Anatomy of the eye. Sclera. The protective outer layer of the eye which is referred as white of the eye. Cornea, front portion of the sclera which is transparent and allow light to enter the eye. Choroids, the second layer of the eye which contains blood vessels and provide nourishment. Iris, part of the eye that gives color. Lens, transparent biconvex structure. Retina, innermost layer of the eye which converts images into electrical impulse. Drugs used in the eye. Miotics, example pilocarpine hydrochloride. Mydriatics, example atropine. Cyclopegics, example atropine. Anti-inflammatories, example corticosteroids. Anti-infectives. Anti-glaucoma drugs, example pilocarpine hydrochloride. Adjuncts, example irrigating solutions. Diagnostic drug, example sodium fluorescein. Anesthetics, example tetracaine. The preparation of ophthalmic solutions and suspensions requires special considerations. First, sterility. To maintain sterile condition in the ophthalmic products, the solution is autoclaved at 121 degrees Celsius for 15 minutes. Isotonicity. All the ophthalmic products should have proper isotonicity. Your eye membrane is permeable and only solvent molecules can penetrate into the eyes. Osmotic pressure. The solvent passes into more concentrated solution until equilibrium is established on both the sides of the membrane. The pressure is responsible for the movement and it is termed as osmotic pressure. The solutions with more osmotic pressure is known as hypertonic solution and the solution with low osmotic pressure is referred as hypertonic solution. Buffering agents. They are responsible for the pH of the ophthalmic preparation. Buffering agents may be adjusted for greater comfort to the eye, and it also enhances aqueous solubility of the drug as well as bioavailability of the drug. Viscosity and thickening agent. The role of thickening agent is to increase the viscosity, which increases the contact time in the eye tissues and enhance the therapeutic effect. Example, polyvinyl alcohol and methyl cellulose. Preservatives. To prevent the microbial contamination in the ophthalmic preparation, preservatives are added. Example, 0.01 to 0.1% of disodium edetate, benzalkanium chloride, phenyl mercuric nitrate, phenyl mercuric acetate. Factors that affect ocular bioavailability. Protein binding. Protein bounded drugs are incapable of penetrating the corneal epithelium due to the size of the protein-drug complex formation. Because the short time in which the ophthalmic solution may remain in the eye, the protein binding of the drugs could prevent its therapeutic value by rendering it unavailable for absorption. Metabolism. Tears contain enzymes which may lead to the metabolic degradation of drug. Other factors affecting ocular bioavailability is physiochemical characteristic of a drug, product formulation. Semi-solid ophthalmic preparation. Oleaginous ointment bases are used in semi-solid ophthalmic preparation. These ointments are suitable for the drugs which are hydrolyzed easily. The main disadvantage of ophthalmic ointments is their greasy nature and blurring of vision. The advantage of semi-solid ophthalmic preparation is they have prolonged retention time in the eyes and increased intraocular contact time of the drug. Liquid ophthalmic preparation. Examples: eye drops, solutions, and suspension. Ophthalmic solutions. They are the sterile solutions free from foreign particles, suitably compounded and packed for easy instillation into the eye. Examples: atropine sulfate eye drops, pilocarpine eye drops, silver nitrate eye drops, zinc sulfate eye drops. Suspension. The drugs which are not sufficiently soluble in water are formulated as suspension to improve stability, bioavailability, and efficacy. Most probably, steroids and anti-inflammatory agents are used in the form of ophthalmic suspensions. Example: fluorometholone, prednisolone acetate. Preparation. They are of three types: non-erodible ocular inserts, erodible ocular inserts, and contact lenses. Non-erodible ocular inserts are soft, flexible, and designed to be placed in the cul-de-sac between the sclera and eyelid for continuous release of drug for a steady state. It consists of three major components, which include drug reservoir, which contains drug and the carrier material. Secondly, a rate controller membrane which controls the rate of the drug delivery, and annular ring which is the outermost covering. Erodible ocular inserts. They are easily absorbed by aqueous tear fluid, gradually erode or disintegrate. The drug is slowly leached from the matrix and they quickly lose their solid integrity. They possess an advantage over a non-erodible membrane or soft contact lens insert. Contact lenses. Classified into three types: hard contact lenses, soft contact lenses, rigid gas permeable lenses. Contact lenses. They are usually made up of rigid plastic resin which is polymethyl methacrylate and ranges between the diameter 7 to 10 mm, covers only a part of a cornea, and it requires adoption time for wearing comfort. Soft contact lenses. They are popular than hard lenses because of the greater comfort. The diameter ranges from 13 to 15 mm, covers the entire cornea. Rigid gas permeable lenses. They are constructed for oxygen transport. They are oxygen permeable but hydrophobic, provide greater wearing comfort than hard lenses.